There shines a light just beyond the hills. I see the rays of sun arising. Day's gonna be a gorgeous day. There is hope and there is healing for all the people who are in pain. Sun shines bright across the Blue Ridge Mountains from the rays of a Nelson County sunrise.
It began in 1985 in a small manufactured building with one doctor, one nurse practitioner, and a small staff. In the first year, they were seeing an average of 9 patients a day, 2,500 patient visits a year. Today, the Blue Ridge Medical Center sees 12,000 patients a year, most from Nelson, but also many from surrounding counties. The center needs to grow to continue to meet the area's needs. So, it's time to invest in a healthy future.
There is hope and there is healing for all the people who are in pain. Sun shines bright across the Blue Ridge Mountains from the rays of a Nelson County sunrise. Rise up, Nelson County sunrise.
Met the family through Head Start, and it was clients anyway. So she had 3 children, and the youngest had a problem with his teeth, and he went to a dentist in Charlottesville, and he referred her to MCV. She had no transportation to get there. It was a long process, and the child sucked his food because he couldn't chew it because it was too painful.
We live in a dental health professional shortage area, and the demand for affordable and accessible dental care is growing dramatically in the area served by Blue Ridge. We have a small dental trailer with 2 chairs, open a few days a week, staffed with volunteers.
We've done a lot of needs assessments in Nelson County, and every single one of them has pointed to the need for dental care and affordable dental care, especially for adults. We can usually find resources for children one way or another. It's always outside of the county, but we need more resources for adults.
Dental care is extremely important to maintaining overall health. It's really a gateway, I think, to an overall healthy lifestyle. And hopefully with the new clinic we'll be able to meet the need here in Nelson County very effectively.
I'm hoping that it will really help expand the access to care. I feel that there are so many people here in the county that don't have the access to care right now. This clinic is pretty much it, and as you can tell, we have 2 chairs. We'll have many more chairs. Hopefully we'll have more staff members be able to see a lot more patients and just give people the access that the county needs.
It will cost $1 million to create a new dental clinic in the older Blue Ridge building once the new medical center building is complete.
That family with bad teeth, including the one that sucked his food, will have some place to go.
Basically, we're limited to an area that's far too inadequate for the number of techs that we have working. It creates a potential unsafe situation, in my opinion, because you've crowded too many people into too small a space, increasing stress.
Blue Ridge has a pharmacy, but it has run out of room.
In addition to just the need for education and teaching, we need to be able to have a place that we can speak with the patient confidentially. A lot of the things that we need to talk about aren't things that we care to share with everyone in the waiting room. So, space, not only for teaching and education, but also for confidentiality, privacy, and things like that are important as well.
An expanded pharmacy will allow larger orders of drugs for the Medication Assistance Program and lower the cost of prescription drugs even more. It will also allow private patient counseling and education.
With your help, we'll have about 3 times the space, and that will include workstations as well as storage space, and this will enable us to work more safely and also to serve more people with a greater variety of medications and payment options.
One of the things that that we're meant to do, and our mission, that is part of our mission, is to reach out into the community and find the people who are in need of care and are not getting it, and find the kinds of care that we're not providing, or that where there are gaps in the community for services. And so the Rural Health Outreach Program is all about that. They go out into the community, they find the people in need, and they identify the needs that aren't being met, and they work to accommodate those needs.
The expansion will bring the Rural Health Outreach Program from Lovingston into the Blue Ridge building, allowing for greater coordination and education. The expansion will also bring a new telemedicine capability that will make medical expertise from the University of Virginia Medical Center and Martha Jefferson Hospital available face-to-face without a drive to Charlottesville.
Right now our telemedicine services are located in our conference room. It's not very private, and it's not very well suited for what we need to use it for. And so we are going to put a telemedicine equipment in exam rooms, specially designed exam rooms in the new building, and that will allow privacy for our patients and better access to the specialists at UVA and other places where we can access care for our patients.
Although the Blue Ridge Medical Center expansion has drawn federal and state grant money, to see this project through, we need to match these funds with $1 million from other sources. That's where you come in. Here is a list of naming opportunities to help you decide how you can help. There are other ways to help. The center is selling bricks for a walkway and plaza, and you can also buy leaves on a tree of life. So please, invest in a healthy future.
There is hope and there is healing for all the people.